Next up is the palpation. So we're going to start on the head of the fibula. Fibula being on this outside edge here. Okay, so we're going to be palpating this knee. We want their knee nice and exposed, and we want the head of the fibula. So we have felt down here with the ankle. Now we're up at this end. So again, a line between the knee joint and the ankle is essentially where the fibula lies. So from around about halfway, we're going to work our way up along this line until we reach, there we go, a very, very prominent landmark of the head of the fibula right the way around there. Okay. Next up is the patella. Okay, so the patella being on the very front of the knee just here. Now the patella is particularly mobile when the leg is extended, and as long as the quadriceps are nice and relaxed, this patella moves around nice and freely. Okay, so we're going to feel the patella. So we have a medial border, a lateral border, a superior pole and an inferior pole. So we will feel it here and here, right the way around the top and all the way down underneath. Okay. Other things we're not going to ask you to do, but you can also start to assess how much that patella moves in the different directions, which we'll come to in the future. Okay, but for now, you're going to feel all the way around and then also just over the top of that patella. Okay. Next is the tibial tuberosity, which we have done before in the ankle. So we'll just do part way through from the anterior border of the tibia, running all the way up the front until we come to this landmark here, just sticking out the very front, which is our tibial tuberosity. From the tibial tuberosity, we can also feel for, this is one of the few times where you can sit on slightly on the bed with the patient just to stabilize their leg. Okay, so we can feel for the tibial tuberosity here, and from the tibial tuberosity, that also then follows the tibia round laterally and round medially, which is the tibial plateau, so the flat surface of the top of the tibia. So from here, I can then feel all the way along the tibial plateau. So for the tibial plateau, you're feeling the tibia. You're not trying to feel in the joint, you're feeling the tibia. That is just below the joint line. On your sheet, you'll see joint line in brackets because it's perfectly in line next to it. If you were feeling the joint line, then what you would do is you just come up ever so slightly, and now what you're feeling is the gap between the femoral condyles and the tibial plateau, okay, which we'll come to in just a second. So the next one is the condyles and epicondyles of the femur. So in this flex position here, what we've done is we've exposed the front of the tibial condyle, the femoral condyles, just coming round into the joint. Where the patella is, it's hiding some of it. And so what we can do is from the very front, remember this is the anterior surface of the thigh, we can feel from here, and I can feel the lateral condyle and the medial condyle. So I can follow both of them. I can go one at a time. Medial condyle, right the way around there. I'm right on the edge of the medial border of the patella here. Right the way around and down into the joint. Same on the lateral side. Feeling all the way around. Again, the patella is almost just slightly in my way there. And then round and down into the joint line. So those are the condyles, the joint surface. Epicondyles, we can then come to a focus point, which essentially is where the axis of rotation of the joint is, at the outside edge here of the condyle. Easy way to find it, palm of the hand on the lateral, palm of the hand on the medial, and work your way down. You're on tissue, 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 bone. And very quickly you start to feel that there are two bones sticking out medial side, which is the epicondyle, and lateral side, which is the epicondyle. Okay. Then for the joint line, as we discussed before, tibial plateau is just along here, and what we need to do is bring our fingers up just ever so slightly, and as we then come along that joint line, what we can do is we can feel all the way around the actual joint line of the tibiofemoral joint, just above the tibial plateau. So as we're coming up from the tibial plateau, we are in the joint line between the femoral condyles and the tibia, just in there. Last ones is the lateral collateral ligament and the medial collateral ligament. So the lateral collateral is from the lateral epicondyle to the head of the fibula. You've palpated both of those, so you should then be able to feel between the two. There it is and there it is, and it's just along that point there, and that is our lateral collateral ligament just in here. Whereas for the medial collateral, again, same thing, we can bend our knee up here, coming from the medial epicondyle, which is then just there, and it comes down and anteriorly, it's a much broader band, down and anterior onto the medial tibial flare, which essentially is where, from the medial border, it flares out. Yeah, so it comes up and flares here, it's just down into there. From there to there, much broader and flatter. Not very easy to feel. The lateral collateral sometimes you can feel, medial collateral not so easy. But that is its path, and as long as you feel its path, then you would be able to feel if it was painful or not. Okay?